Good morning, everybody. Nowhere to hide is the government's message as they reveal a 10-year plan to tackle drug crime in England and Wales. Gangs, drug kingpins and even middle-class users will be in their sights. Reports this morning harsher punishments could be dished out to deter drug users, such as removing their passports and also their driving licences. The Policing Minister, Kit Malthouse, is with us shortly. First, here's some of the key announcements for you. The government will invest £300 million in closing down gangs involved in the drugs trade, and the police will be tasked with carrying out more than 6,000 disruptions against their activities. The strategy also outlines plans to dismantle 2,000 more county lines distribution routes, having already closed around 1,500 in the last 2 years. The strategy will also include the largest ever funding increase for tackling addiction and repeat offences, after the Home Office said there are as many as 300,000 heroin and crack cocaine addicts in the country who are responsible for almost half of all acquisitive crimes, such as burglaries and thefts. Joined now by the Policing Minister, Kit Malthouse. Mr Malthouse, good to have you with us this morning. Thank you for joining us. It's a 10-year plan, I believe, to combat drug-related crime. Could it really involve taking people's passports away from them?
Well, in time, yes. I mean, one of the things we're focusing on to begin with, as you quite rightly said, Kay, is the disproportionate amount of crime driven by heroin and crack addicts. But we also need to reflect on the fact that there are an awful lot of kind of lifestyle users of cocaine and other drugs out there who are driving much of the violence and the degradation that we see from drugs overall. And so what we're going to do is publish a white paper next year looking at what we can do to try and turn them away from their particular habits. And that might involve, we hope, interfering in their lives in a way that brings about behavioural change. We've seen that in other parts of government policy. If you look at the Child Support Agency, where people, I was responsible for that for a while, where people don't pay their support, courts do have a power to remove their passport and their driving licence. These are the kind of impositions on a kind of lifestyle which we hope will bring about behaviour change over the next decade.
If it's true that 11 out of 12 locations tested in the House of Commons tested positive for Class A drugs, it could be that some of your colleagues find themselves in that position.
Well, I hope not. There are obviously several thousand people who work on the estate, and I'd be surprised if there weren't some lifestyle users of drugs amongst them, I have to say. But what we want to try and do is get to a situation where the police and other authorities are concentrating as much on that part of the drugs industry, as you like, if you like, as they are on crack and heroin. We need to make sure that we drive crime numbers down overall. The drugs industry brings a lot of violence and degradation and victimisation into this country, and so attacking the supply, which, as you say, we've been doing with real vigour over the last 2 years, and accelerating that over the next decade is critical. But we also have to look at demand at the sharp end, at heroin and crack users who need to be treated for their addiction as well as punished for their crimes, but also then moving on to the much bigger group of those who are driving this trade of powder coming from across the world to the UK, who are driving that trade. We need to turn them away from it as well and deal with their offending and their behaviour.
You talk about lifestyle use. It makes it sound almost acceptable in the House of Commons.
Well, it's not acceptable. I mean, I've been struggling for a word. People say recreational, they call it middle class, lifestyle, whatever it is. It's use that is driving a lot of violence and a lot of misery. And there are lots of young people, as you will know, in the capital and elsewhere, who are dying as part of that trade, being stabbed and killed. You know, just in the last 2 years, we've rescued about 4,000 young people who've been dragged into the drugs trade as part of county lines. And so the idea that that kind of casual usage on a Saturday night is somehow a victimless crime is ridiculous and immoral. And we think that those people need to focus on their behaviour, and we need to find a way in society that we make it unacceptable. We impose on their lifestyle in the same way that over the last 20 or 30 years we've made drink driving unacceptable socially. We'd like to do the same with drugs.
Labour says it's your fault because you cut £100 million from drug treatment services since you came to power.
Well, obviously, Labour do a lot of shouting and arguing about the past, but in truth, the drugs industry has changed significantly over the last 10 years. We saw declines in usage, to a certain extent a decline in drug-related crime, and then that industry sort of reacted, right? It did what most industry would do. It found a better product, made it cheaper, new ways to distribute it, opened new markets. It's a very interesting economic and business dynamic, if you like, that meant that we needed to address it. Now, 3 years ago, we commissioned Dame Carol Black to have a look at drugs. We're so alarmed about it. This strategy today is a response to that, but it builds on the work we've been doing for the last 2 years, closing down these hundreds of county lines across the country, building these recovery projects in places like Blackpool and Norwich and Middlesbrough, where we've brought everybody together to turn lives around, particularly those on heroin. Now we can turbocharge that effort going forward. The critical change for us, Kay, is that we recognise that this is a business, right? What these drug dealers are doing is trying to make money. And if we can interfere in their business, both in terms of reducing demand, but breaking the supply chains, then hopefully we'll drive activity down once and for all.
OK, let's talk about Omicron. Should read that Greek letter that none of us thought we would ever know much more about. More than 50% rise in a day of Omicron cases, but the impact on deaths and hospitalisations has been minimal. In other words, there haven't been any at this stage. Are we massively overreacting?
Well, I don't think we are. We're being proportionate and precautionary. I mean, obviously, we don't know completely what this variant is going to do. We know it seems to be quite infectious, but we don't know yet exactly how difficult it's going to be for people's bodies to cope with. That research is ongoing. We've got world-beating science, world-leading scientists who are able to give us those answers over the next 2 or 3 weeks. In the meantime, what the Prime Minister said, look, let's be careful. Right, let's take it steady. Let's wear masks in certain areas where we think there's likely to be transmission. Let's think about travel more carefully and make sure we do testing at the border to restrict the virus coming in, to buy us a bit more time. But fundamentally, let's be proportionate about it and get on with our lives to a certain extent and try and have as merry a Christmas as we possibly can. So we're learning as we go. Don't forget, Omicron is quite a way down the alphabet. That means between Delta and now, we've been through a number of variants that haven't got very far. Let's see where this one goes. But for the moment, steady.
OK, get you with your Greek studying at school. The US, though, has an awful lot of scientists as well, world class too, including Dr. Anthony Fauci, who's top of the tree. And he's told the leader there that actually the travel ban should be lifted. Should we do the same?
Well, let's see. As I say, Kay, we've got these amazing scientists at Porton Down, just on the edge of my constituency, who are doing that research right now, subjecting this virus to various tests to see how it responds, see what we know we can learn about it. And, we know that the work we do here in the UK has been leading the world and informing much of what the world does around this virus. So I have great confidence that they'll give us a much clearer picture of the next 2 weeks. And until then, it feels to me, doesn't it to you, that we should be cautious?
I think all I'm doing is trying to clarify whether if the US is lifting the travel ban, we are saying, OK, good for you, but we're not going to do ours this side of Christmas.
Well, I think, look, we'll be informed by what comes out around the world. What the Prime Minister said, the restrictions will be reviewed in 3 weeks. We need a bit of time to form our own view about what this virus is capable of. Then we'll be able to look at the picture. But as I say, review well, it'll now be in 2 weeks, won't it, of the measures that have been put in place. But it seems to me pretty sensible and proportionate, off the back of the fact that we're in a much better place than a lot of countries, right? The decisions we made in the summer are paying dividends now. The booster programme is going really well. 20 million people now, I think, and rising. I've got my booster a week today. Hope you've had yours, Kay. People are really building their enthusiasm now for that programme. And if we carry on as we are, then hopefully all will be well.
Thank you for sharing with my audience, Minister, that I'm a lot older than you. Pre-travel COVID tests.
No, mine is delayed. Mine's delayed because I had COVID.
Well
in
saved,
March,
Minister.
So I had to delay
saved.
Mine. You weren't like.
Yeah.
It's true.
OK. Yeah, and I had mine early. I didn't. Pre-travel COVID tests, day 2 pre-departure tests. Why did we ever get rid of those? If we're only going to put those in as a knee-jerk when we get one of these variants in, it's already too late. We need to shut the door before the horse has bolted.
Well, no, we have to be agile, right? We have to recognise that all these things are impositions on people's lives and lifestyles. They're obviously extra cost, and they cause difficulty for the travel industry. Now, we need to try and smooth that as much as possible and be proportionate about our response. You know, we've got family overseas. We're going to be travelling at Christmas. We're having to have tests in and out, both ways. And it is a total pain, especially if you've got kids, right? So we understand that. And so we have to be proportionate and make these judgments at the right moment. That's what we've done. And it feels to me as if in the face of the unknown on this virus at the moment, for the next few weeks, that's where we need to broadly be.
But surely they're only ever effective if they're left in place until we see the back of this pandemic. Otherwise, we're saying, oh, it's already in, we need to put these day 2 tests, pre-departure tests in again. It's too late by then.
Well, I don't think it necessarily is. I mean, obviously, there's lots of testing going on, right? We're in a great place on testing. People have got used to it. They understand it. But there are lots of requirements around the world, and there's movements of virus around the world that we need to pay attention to. So being agile, it strikes me, is the best thing, Kate. We want to try and live as normal a life as we possibly can as the various, evolutions of this virus work their way through the system. And that means that we're going to have to, duck and drake a bit, I'm afraid. Now, Prime Minister is doing his best to help us live as normal a life as possible, recognising that we don't know everything we need to know yet about different variations, and that we might need to do certain things like this as time goes on. So I think the British people generally accept that notion.
OK, here comes the Christmas party question. The police commissioner, the London Police Commissioner, Cressida Dick, says reports of this party, or one of the parties at number 10 on the 18th of December, have not been reported to her. Should they be?
Well, I thought somebody had reported. I read in the paper that some Labour MPs had reported this supposed event. I mean, as I say, Kay, I know nothing about it. I've been assured by number 10 that no rules were broken. If there was a gathering of any kind, for your information, at the time I was kicking indoors in Basildon with Essex Police on a drugs gang, which is what I'm here to talk about. But yeah, I mean, the police will have a look. It's for them to form a judgment.
She said that it's not been reported to her. If it has been reported to the police, should they investigate?
Well, that's a matter for the police. I mean, the police get reports all day, every day of things that have happened, and they make a judgment about that. And it would be wrong for me, as the policing minister, to seek to have a view about a particular police investigation. We don't generally comment on those things. But right, we are assured that, or I've been assured that everything was done
yesterday, and didn't he?
At the time,
the Justice Secretary did yesterday, and also Deputy Prime Minister. He said if any rules were broken, then if there was a breach of the rules, then it should be investigated. And if it happened, indeed, is what he said. But if it did happen, it would be a breach of Tier 3 rules. Surely, if a crime potentially had been committed, it should at least be looked into by the police.
Well, you're asking me to answer a hypothetical question about this issue. But my general view is that where crime is reported, the police should investigate.
Yeah, I mean, it's not really answering the question, is it? And I know that the government is also keen to have free speech over privacy. That's what we're being told about at the moment. Mm-hmm. So given that there should be free speech over privacy, shouldn't the public know whether or not there was a party at number 10?
Well, as I say, the questions have been asked. Number 10 have said that everything was complied with. If reports have been made to the police, then they'll no doubt have a look and form a view about whether an offence was committed or not. As policing minister, my view is that if offences are committed of any kind and reported to the police, there should be an investigation by the police. They have to examine it and decide whether they are going to pursue it. And that's a decision for them and not something that I, as a politician, should seek to influence. Whether it's through your kind
I
invitations
understand,
or
Minister,
otherwise.
but it's just really irritating, isn't it, for the public? I mean, if there was a gathering of any sort that involved people getting together, having a drink after work, then that would have been a breach of Tier 3 rules on the 18th of December last year. And as a result, it would have been against the law. So surely the public should know whether that happened or not.
Well, I assume that any inquiry that is made by the police will examine those issues. as I say. Number 10 are reassuring everybody that all rules were complied with during that period, and I take that reassurance at face value. But no doubt if the police are alerted, they will have a look and they'll form a view, and we'll all learn more about it in the days to come.
Which brings me back to my question, which is, should the police be investigating an alleged breach of Tier 3 rules?
Well, the police should be investigating anything that is a historic crime that is reported to them. It's hard for me to go any further than that, Kate, because we don't generally comment on specific cases or inquiries as ministers. That's not proper for us to do. But in terms of what the police's responsibility is, I think they're very aware of that. If reports are made, then inquiries should follow, and let's see where it goes after that.
OK. Fast forward a year. What can and we can't do this Christmas season?
Well, obviously, the Prime Minister said you can go about your normal business, but there are some specific restrictions around mask wearing. So you have to wear a mask in a retail environment and on public transport. Obviously, some restrictions which we've discussed on travel in terms of testing to make sure that we're not importing the virus. But otherwise, what he said is that we should go about our business. I will be taking my team for a Christmas dinner next week out at a restaurant in the West End to support that industry and also have some fun at the same time. I hope you will be too. We will be masked up where appropriate, and I'll be taking a lateral flow test to make sure that I'm negative before I participate. As I did this morning, Kate, before I came to see you, conscious as I am of your safety too.
Thank you very much. I did exactly the same before I came in this morning, Minister. How many people will be in your party next week?
I think there'll be 6 of us.
OK. And what are you doing on Christmas Day? Will you be in a family gathering as well? We were speaking to Sajid Javid, and he was talking about if he was in a group of maybe 200 or 300, he would take extra measures. I'm not sure how many of my viewers ever go to a party of 200 or 300.
Well, if you're interested, I will be overseas for Christmas, I hope, having been tested appropriately on either side. The other half of my family are Canadian, so we'll be there and we'll be observing the regulations in that country.
OK. Well, good luck with your booster jab. It doesn't hurt a bit, and if you can have your flu vaccine at the same time, go for it.
Well, I will try and do both. I have to say the first one I felt slightly dizzy, but then it's been fine, so fingers crossed it'll go well.
Was it AstraZeneca, though, or what did you have?
Yeah, I had AZ twice, so that means
Yeah.
I think this time I'll get something different, either
Pfizer.
Moderna or Pfizer. So we'll see how it goes. But I have to say, I was one of the lucky ones. When I had COVID, I didn't have any symptoms. I did my 10 days, constantly testing myself temperature-wise, but nothing happened. So fingers crossed it stays the same. I feel for people and I've got lots of friends who've been hammered hard by the virus. It's been really tough for a lot of people. But the booster is the way forward, and I'm so pleased that you've had yours, Kay.
And you too. Keep well, Minister. Thank you very much indeed for joining us. Thank you.
Thanks a lot. Cheers.